पहला किडनी ट्रांसप्लांट अगर हम कहें कश्मीर में जिन्होंने किया था उनका नाम डॉक्टर तजमुल फाजली साहब हैं।
And that's what got me back.
ये हमेशा सताता था बाहर,
हमेशा सताता रहा। पहले दिन से, जिस दिन से मैं निकला उस दिन से ये सताता रहा कि कैसे वापस आऊं। 1981 में मैंने मेडिकल कॉलेज यहाँ श्रीनगर से अपना हाँ जी ज्वाइन किया। 1986 में तालीम MBBS कंप्लीट किया। उसके बाद अल्लाह ताला के फजल से आई वाज प्रिविलेज्ड, आई हैड अ मेंटोर प्रोफेसर महमूदा खान। It's from the core of my heart that I want to
you
thank
still
her.
value.
I do. She's an old woman now, but the values she inculcated in me.
बिस्मिल्लाहिर्रहमानिर्रहीम, अस्सलाम वालेकुम। दुनिया भर से देखने वाले जितने भी नाजरीन हैं, आज का प्रोग्राम बड़ा इम्पोर्टेंट है। और आज का प्रोग्राम इसलिए इम्पोर्टेंट है क्योंकि आज के प्रोग्राम में हमने जम्मू कश्मीर ही नहीं बल्कि मुल्क के मायानाज, काबिल तरीन और मुमताज डॉक्टर तजमुल फाजली साहब को मदऊ किया है, जो आज हमारे प्रोग्राम में रहे हैं। दोस्तों, ये डॉक्टर ही नहीं बल्कि हमारी शान है, हमारी पहचान है कश्मीर की। पहला किडनी ट्रांसप्लांट अगर हम कहें कश्मीर में जिन्होंने किया था उनका नाम डॉक्टर तजमुल फाजली साहब हैं। और इसलिए आज डॉक्टर तजमुल साहब को आप सब मुबारकबाद दें, हम भी मुबारकबाद देते हैं। सर, बहुत बहुत शुक्रिया, थैंक यू सो मच। डॉक्टर साहब, सबसे पहले आपसे ये जानना चाहेंगे कि आपने जम्मू कश्मीर के शोबे सेहत को जिस तरह से एक अरूज दिलाया, एक ऊंचाई पे लेके चले गए, लेकिन फिर बाद में अमेरिका, बाकी जगहों पे भी आपने अपनी जो एक्सपीरियंस है, एक्सपर्टीज है, उसको यूटिलाइज किया। सबसे पहले आपके बारे में जानना चाहेंगे सर, क्या शुरू से ही चाहते थे कि मैं डॉक्टर ही बनूं कि कुछ और भी शौक थे आपके?
अस्सलाम वालेकुम एवरीबॉडी, इट्स अ प्लेजर। मैं आपके साथ यहाँ हूँ एंड आई एम एबल टू कम्युनिकेट विद द कम्युनिटी 22 साल के अरसे के बाद, जैसे आप फरमा रहे थे।
आफ्टर 22 इयर्स?
हाँ जी, मैं 2002 में यहाँ से निकला था श्रीनगर से। 2024 एक साल हो गया वापस आए हुए। तो दिल की ख्वाहिश यही थी कि दुनिया तो देख ली अल्हम्दुलिल्लाह, बट यही ख्वाहिश थी कि वापस आऊँ, कम बैक टू माई होमलैंड and be able to contribute and do something for my home community, and that's what got me back.
ये हमेशा सताता था बाहर,
हमेशा सताता रहा। पहले दिन से, जिस दिन से मैं निकला उस दिन से ये सताता रहा कि कैसे वापस आऊं। And more so, I might add here, I have aging parents. That was a driving force. Put together old age parents, frail. They did for me what every parent does for their child. But I wanted to give back a little bit to them and to my parent place, which is my homeland, Kashmir. And I feel privileged and happy कि अल्लाह ताला ने दियुत में ये तौफीक बहुत वापस यत थोड़ा बहुत अगर कह पन्ने कम्युनिटी खतर करित सो अल्लाह ताला से जिनायत।
तो डॉक्टर साहब, चूंकि ये सफर थोड़ा सा बता दीजिए कि आपने पहला किडनी ट्रांसप्लांट किया है, उसके बाद आप US गए, इंग्लैंड गए, बाकी कंट्रीज में, ममालिक में आपने दुनिया देखी है, दुनिया भर के पेशेंट्स को इलाज किया है। अपने सफर के बारे में थोड़ा सा बता दीजिए हमें।
इंटरेस्टिंग क्वेश्चन। देखिए, मैं 1981 में मैंने मेडिकल कॉलेज यहाँ श्रीनगर से अपना हाँ जी ज्वाइन किया। 1986 में तालीम MBBS कंप्लीट किया। उसके बाद अल्लाह ताला के फजल से आई वाज प्रिविलेज्ड, आई हैड अ मेंटोर प्रोफेसर महमूदा खान। Whatever little surgery,
she's your mentor.
She's my mentor. She has been I have been to the West, but wallahi, it's from the core of my heart that I want to
you
thank
still
her.
value.
I do. She's an old woman now, but the values she inculcated in me, that went a long way in shaping my surgical career.
So does it matter for the generations who are watching as of now, these values? Does it matter?
It really does. It really does. I mean, she was a lady who had trained in the United States back in the 50s. And then she came back again. I believe she had an old father whom she came to look after here.
Which is why she came.
And then she headed the department of general surgery in medical college.
So इत्तेफाक ये भी है, आप भी आए अपने पेरेंट्स के लिए।
अल्लाह के फजल से।
And what a value.
Honestly, I'm privileged. She has taught me the basics in surgery. So that's when I got my initial surgical training. फिर मैं मद्रास गया, मद्रास में उसके बाद इंस्टीट्यूट चला गया।
अच्छा, पहले इंस्टीट्यूट चले गए?
जी
अपने स्किम्स?
हाँ जी। I was in SKIMS. I was a consultant in general surgery there. I did about 4 or 5 years of general surgery before, जब मैंने यूरोलॉजी के लिए फिर 3 साल में मद्रास चला गया, मद्रास से यूरोलॉजी ट्रेनिंग की। And I happened to be, this is again, interesting. It might be interesting for the public. I was involved with the first cadaver kidney transplant at Apollo Hospital, Madras in 1996.
Great, great sir.
तो उसके बाद अल्हम्दुलिल्लाह वापस आया 1998 में वापस ज्वाइन किया इंस्टीट्यूट 1 जुलाई 1999 अल्लाह के फजल से एंड बाय पेरेंट्स की दुआ से I was able to be a part of the first kidney transplant of J&K 1 July 1999. उसके बाद I was 3 years I stayed back at the institute 2002 तक इंस्टीट्यूट में रहा. I was an associate
Only
professor.
3 years
After 99.
after this kidney
After the
transplant.
kidney transplant.
Okay.
Till 2002, I was at the institute. Again, for reasons which I don't want to make public, I had to. I mean,
There are certain reasons
there
which
are
are never to be.
which go to you.
Exactly,
Which
exactly,
go
exactly.
with you.
Which you keep there.
Which
Only.
you keep there. There's no point discussing in public. I had to leave. I left in 2002. फिर 2002 में I went to England. I was in England in a place called Maidstone, where I was for about 4 odd years.
So was this crave or something for the medical sciences, or it was something which drew you to different countries?
No, to be honest with you, I'm happy you asked me this question. I never wanted to leave Kashmir.
Okay.
Wallahi, that
Never ever.
Never. It was not in my wildest dreams I would have thought that I would one day leave Kashmir. I was happy with what I was doing in Sher Kashmir Institute. But as I said, for reasons which is beyond the discussion of this scope of this
I can
discussion,
understand.
I don't want to make it public. Right or wrong, I had to leave. I left in 2002. I landed in England. And alhamdulillah, I was able to do a fellowship in uro-oncology, especially cancer surgery, prostate cancer surgery, bladder cancer surgery, testicular cancers, and things like that, kidney cancer surgery. And I was lucky to be trained. Once again, I want to name my mentor in England. There's a gentleman called Professor Gulzar Mufti. He's a Kashmiri guy.
He's a Kashmiri again?
The first MCH student pass out from J&K, Professor Gulzar Mufti. He was a professor and director of the hospital where I got it. He gave me a break in England, and I was lucky to have spent time with him. He again mentored me. My skills got honed over these 4 years I was in England. But then again, I decided to move from England. The reason being, those days, the job situation was extremely tight.
Okay.
To become a consultant means you are an independent practicing consultant. It had to be a cutthroat.
Oh.
So I found it rather, things have changed now.
Now things have changed.
One go changes. I mean, a lot of Kashmiris are consultants in different departments there. But those days, way back in the early 2000s, it was different.
The scenario was completely.
It was entirely different. So I decided to move to the US. My brother lives in the US. I have a lot of family in the US. Bebuju, Dana Pani.
Dana Pani,
It was destiny. So I moved to the US in 2007. And then, alhamdulillah, I'm happy I went to the US because the US is a different ball game. The sky is the limit in the United States. You just have to be an honest, hardworking, average human being. You don't have to be superlative to do well in the US. That country just helps you. If they find
To grow.
talent, absolutely. If they find talent,
You mean to say in West, particularly in United States, merit is valued?
absolutely, it is entirely based on meritocracy. If you are a hard, as I repeat, if you don't have to be super intelligent to do well in the US. If you are hardworking, and if you are honest, and if you don't break the law,
Sky is the limit.
this is what I would tell my children. I mean, I have 2 boys. They grew up in the US. Just don't lie. Be honest. Do the right thing. Hardworking, and do not break the law. If you can do this, nobody will touch you in the United States. You will rise. Actually, they encourage talent. That's it. So I spent about almost 20 odd years in the United States. Alhamdulillah, it was a long journey. I learned laparoscopy, endoscopic surgeries, robotic surgery, and you name it. Alhamdulillah, and I'm happy.
Dr. Saab, सबसे पहले, I'm really impressed. Believe me, I'm grateful to you that you have returned to your own soil, which very, very few people do. And जितने भी नाजरीन हमें इस वक्त देख रहे हैं, इस इंटरव्यू के दौरान I have interviewed a lot of people, believe me. But this is for the first time that during this interview, मैं admit करता हूँ, मैं तस्लीम करता हूँ कि ऐसे डॉक्टर्स को हमने सलाम करनी है, जिन्होंने अपनी सारी लाइफ यूनाइटेड स्टेट्स में गुजारी है और अब यूनाइटेड स्टेट्स में हेल्थ वाइज, बाकी इंफ्रास्ट्रक्चर वाइज, दैट्स वेरी डेवलप्ड कंट्री, लेकिन इनको अपने लोग याद आ गए, इनको अपनी मट्टी का कर्ज, अपनी मट्टी का फर्ज याद आ गया, डॉक्टर तजम्मुल फाजली साहब को। और आज इस वक्त हम कश्मीर क्लिनिक्स करण नगर में मौजूद हैं और इनके साथ हमने मुनासिब जाना कि इनसे इनके दिल की बात पूछे कि डॉक्टर साहब आखिरकार कश्मीरी लोगों का दर्द लेके आप वापस आ गए और क्या करना चाहते हैं। डॉक्टर साहब,
थैंक यू सो मच।
वंस अगेन, चूंकि यूनाइटेड स्टेट्स में आपने इतनी खिदमत अंजाम दी है, तो अब क्या ख्वाब रहा है, आगे क्या करना चाहते हैं, पर्टिकुलरली यूरोलॉजी रिलेटेड या जैसे आपने कहा किडनी ट्रांसप्लांट रिलेटेड, क्या है अब मन में?
Well, thank you so much for asking me this question because this is close to my heart. Honestly, I hold it very, very close to my heart, and this is a lot of emotions.
Even I can see that. It's even believe me, ये emotions जो है flow हो रही है आपके चेहरे से इस इंटरव्यू के दौरान, and I can believe me, I'm just seeing those emotions.
Thank you so much. Here is which is just honest. Allah Taala gesi yatsun. I am proud to say here today that I have been associated with Kashmir Clinic Central only for a short span of time. But I find myself privileged and lucky to have found a place like this where I can offer state-of-the-art urological services in an outpatient clinic. Which is different as outpatient, inpatient in the sense that yetishu wintasi Kashmir mazan. I mean, I'm sure we have excellent doctors here. I have hats off to my colleagues and who stayed back during all the turmoil when I left during the peak of militancy. Not that militancy was a factor of me leaving. No, it was not. But they had the courage to stay back and deliver in the toughest of conditions.
Toughest time, bilkul.
But what I am trying to pass on to my people here that I find a privilege to be at Kashmir Clinics Central here in Srinagar.
And what about Dr. Shakil?
Dr. Shakil is he's my mentor here. I mean, he's my local mentor here. I had mentors, as I said, in my teachers, but then there are mentors in different ways, you know, people who get to recognize your talent and then they're ready to take that, you know, the step and take the step forward to get everything together and basically end game and result cash yasana zeis. Ki yus kosher average chu emis gos melun superlative care at their doorstep. That's the idea.
You won't believe, एक दिन डॉक्टर शकील साहब से मेरी भी बात हुई, उन्होंने कहा कि मैं कुछ भी स्टार्ट कर सकता था, मतलब अगर बाकी चीजों में इतना ज्यादा इन्वेस्टमेंट करता है इंसान तो ऑब्वियसली यू कैन गेट लॉट ऑफ बेनिफिट्स. दिस इज पर्सनल एक्सपीरियंस, माय पर्सनल एक्सपीरियंस. सो उन्होंने कहा कि हेल्थ में इसलिए बिकॉज ही वांट्स टू डू समथिंग फॉर द पीपल, जैसे आप कहते हैं डॉक्टर साहब. तो डॉक्टर साहब, चूंकि लेट्स कम बैक टू दिस यूरोलॉजी, इस रिलेटेड अगर बात करेंगे हम, व्हाट इज द डिफरेंस बिटवीन पेशेंट्स यू हैव एक्सपीरियंस्ड इन यूनाइटेड स्टेट्स और यहाँ का हेल्थ इंफ्रास्ट्रक्चर जब हम कंपेयर करते हैं, तो क्या क्या आप वहाँ पे डिफरेंस महसूस करते हैं?
Which it's interesting. I mean, in the United States, health insurance, a majority of it, I should say the vast majority, insurance related. People have insurance, health insurance. I am happy that you brought it up, and I want to pass it to my community. Health insurance, I think it's the necessity of the hour. Which was issue good.
You mean say Astipaz health insurance?
Absolutely. Which is I'll give you a simple example. Issue no good. What is necessity cash? Mandatory lazim cash.
Insurance.
Insurance.
बिल्कुल.
अगर न गाड़ी इंश्योरेंस है कि यो शगुन गाड़ी कर सड़क पे हकन गाड़ी चला.
बिल्कुल.
क्या इंश्योरेंस मैंडेटरी which बतपो क्या है 10 नफर से गाड़ी हवान. अल्लाह ताला रचिन यमो 10 गाड़ियों में कतन है एक्सीडेंट गजित. वरियस में एकस गाड़ी, दोन गाड़ी, त्रेन गाड़ियों, 7 गाड़ी से ना बचान एक्सीडेंट निश. मगर प्रीमियम दिवान छ दावई. So you basically those 7 cars जब यमन कार्डन एक्सीडेंट को की, they pay for the insurance of those 3 cars who had an accident.
True.
इथे पड़ अल्लाह ताला रचिन मकान समान नार, मकान बनोमुत इंश्योरेंस आसा 10 मकान मज कतन जन वरियस मज नार, एकस मकानस दोन. So यमन 8 मकान नार होत की तिम च करन
पे
यूज नुकसान.
बिल्कुल बिल्कुल.
Same thing is with health insurance. अगर अस 7 नफर इंश्योरेंस करान छ, अल्लाह ताला रचिन हाथो मज कत्या गसो अस बेमार वरियस मज 2, 4, 5, 6, 10. So यम 9 healthy patient, healthy nafar, tim chikaran pay for the disease of those 10 sick people. It's as simple as that. The atmosphere, really pass current community it helps health insurance because concept was as Wuvari bro, Punsuvari bro, Pansavari bro, medicine go transform. The way we deliver medical care now, it has transformed.
Transformed completely.
When I trained, I X-ray karan, ECG karan, chest X-ray karan, ultrasound it had just come into
vaguely.
To get a diagnosis, go change it is impossible to keep up with the expenses unless we have insurance.
True.
Where is the money going to come from?
True.
So I think I would really appreciate that is the basic difference between the West
and we
us.
people.
And that helps them to give better health care to their people because they have insurance.
डॉक्टर साहब चूंकि अगर इस तुंद फील्ड कत करो ज्यादा कम पेशेंट वुचान चूंकि अगर आम इंसान समझुन तो दोस्तों तुम वनमो बह कि डॉक्टर तजमुल फाजली साहब अमरीका मज इंग्लैंडस मज वन आय वापस कशीर तो पन्न लूकन करन खदमत यूरोलॉजी हवाल कश्मीर क्लिनिक्स सेंट्रल करनगर वुचान तो डॉक्टर साहब कम पेशेंट हेकन ये योर
आम तौर से पेशेंट्स गसान एज वी गेट ओल्डर बेगे सवाल life expectancy increase.
बिल्कुल.
अगर 50 वरी ब्रो, people would not live as long. It is very common to see people living in their 80s. Common.
Common.
और ठीक because life expectancy increase. So as the life expectancy
medical science medical field
yeah, because we are eating better, we are exercising better, we science and so we are getting on the whole life expectancy increase. So the point I am trying to make is as we get older, urological issues they are more common, not more, they are fairly common. I give you example of a prostatic enlargement. Every male patient gets an enlarged prostate.
So
it is normal. It is like aging. I have grade. That's how it
is. That's normal.
That's part of life. If I put your prostate, every man will have an enlarged prostate after 45, 50 years of age.
Okay.
Every woman goes through menopause. So that's nothing to worry about. So we see more prostatic issues as we get older. If I put urinary infections, ladies and urinary infections are common. Stone disease increased. Stone disease it gets diagnosed early. I want better avenues, I see better X-rays, facilities, scans, ultrasound, CT scans, MRIs, PET scans, you name it. So we are able to diagnose a disease earlier and treat it earlier so that we get better results compared to what we had 50 years ago or 40 years ago. Better. So we do see a lot of various. We should be about cancer diagnosis. Cancer is Allah Ta'ala Rishin Saini. Cancer is kidney cancer, example, prostate cancer. During my training 30 years ago, also various late stages diagnosed. Because we didn't have the diagnostic facilities. Yeli patient is the symptom gatsan, patos you want to doctors, patos can diagnose, totos disease asan horror. Winke show asan, momuli other Bakuni Katra, Kershkat abdominal pain, 5 minutes. Yeah, by Mesgate, Basachu, Bactisham, whatever. The first thing he will get exam, Padgesis ultrasound, Padgesis CT, Agar Allah Ta'ala Rishin Kiash, it will be picked up early. So you early diagnosis, early treatment, cure better.
वो घबराने की जरूरत की यमती वुचान डॉक्टर तजमुल साहब अस मौजूद कि ई डॉक्टर हौसला दिवान इंसानस हिम्मत दिवान इंसानस तो अगर तुह खुदा न खास्ता अम रिलेटेड कह इशू तुम वन कि यूरिनरी इन्फेक्शन किडनीज रिलेटेड या प्रोस्टेट रिलेटेड कंस मेल फीमेल तम हेकन करनगर ये डॉक्टर तजमुल फाजली साहब आमत नबर पे वापस तो पन्न लूकन वनस इलाज करान डॉक्टर साहब लास्ट पे क्या मैसेज लूकन यम तुम वुचान वनस सन तमाम माजि बेन या बुजुर्ग यम वुचान
बह दपस चीज थोड़ा सा अगर करो चेंजेस पन्ने लाइफ मज अलहमदुलिल्लाह वी आर ऑल बिलीवर्स अल्लाह ताला पे भरोसे यह सोरे सह दरदस्त अल्लाह मगर पानस तान चीज कर कि थोड़ा सा कर लाइफ स्टाइल I would recommend, I would pass it on to all my colleagues, all my local countrymen, my colleagues, थोड़ा lifestyle changes अगर इस करो, तम से it goes a long way. अश थोड़ा सा eating habits करें.
Eating habits.
अश physical exercise करें regularly क्या. I think these are very, very important things. Instead of taking a lot of, we are mutton eaters.
अच्छा, mutton eaters.
Kashmiris, we eat a lot of,
True.
lot of.
We do.
Which is ठीक शो non-veg tissue क्यों, but at the same time, a lot of green vegetables came.
अच्छा.
Lot of salads that's it, and fruits you can, because it is healthy. We have to take a balanced diet. You shouldn't eat bas mazu yot. Yeah, we take a lot of carbohydrate. Carbohydrate shouldn't say this could take. Again, I said that about hard but. But means a lot of carbohydrate. That's why rice is much water. There's a lot of carbohydrate. So we have to mix our food habits. We have to change in a lot of ways. Then we will be able to live a healthier life. Exercise, when how much younger age group, they have become more aware. Exercise is current. We have to go to the gym. We have to burn our calories. You don't have to be fasting. You have to eat and you have to burn. As long as you eat healthy, you burn your calories. Alhamdulillah, you'll be fine. Countrymen, my local people. I mean, I can tell you my experience. People, men or women, doctors one in here, one gets more so for a urologist, because we deal with patients' genitourinary systems. Genitals, reproductive system, sexual function, these are important. I mean, I try to bring up with my patients, and I'm pleasantly surprised, people who would not ask me this question, when I bring it up in a very polished way, I don't have to be rude, but then they come up with these, because there is a lot of things to talk about.
True.
Reproductive, urological, reproductive, sexual function. These are all important.
Doctor
So I am pleasantly surprised. Patient symptoms. So one has to be forthright. Doctor was one confidence. It is a two-way traffic. So you have to open up patients and confidence gain. When patient complaints, and that helps to coming to a diagnosis. To be Allah shifa Allah Ta'ala say. Shifa bagar pan ko Pakistan se sat karan koshish karan ki yuta gus kas impossible bemarus gus fayda wa.
Chalo sada shukriya Dr. Sahab. Believe me, I would love to continue these episodes with you in upcoming months.
Inshallah.
और मुझे अच्छा लगा. और डॉक्टर तजमुल फाजली साहब, मैंने आपको पहले ही बोला, खासकर यम सन बुजुर्ग माजे बेने यम वुचान वनस, डॉक्टर तजमुल फाजली साहब इस इंटरव्यू के दौरान इन्होंने मुझे बहुत इंप्रेस किया. सबसे बड़ी बात होती है काबिलियत. कशीर हुंद गोडनुक किडनी ट्रांसप्लांट डॉक्टर यानी सर्जन यमो स्किम्स मज ट्रांसप्लांट कोरमुत. तुम पाने पत इंग्लैंडस मज लूकन इलाज कर, पत यूएसएस मज लगभग 10 वरी दित, वन वापस कशीर तो कश्मीर क्लिनिक सेंट्रल श्रीनगर करनगर वातुन. अगर खुदा न खास्ता कह शिकायत आए, बिलीव मी, ऐसे डॉक्टर्स बहुत कम होते हैं, बहुत कम. थैंक यू सो मच फॉर वॉचिंग मी ऑन कश्मीर क्राउन. इंशाल्लाह नेक्स्ट एपिसोड में जरूर लाऊंगा डॉक्टर तजमुल साहब के साथ. जितनी भी डिजीजेस हैं, जितनी भी यूरोलॉजी रिलेटेड इश्यूज हैं, जितने भी इश्यूज हैं, हम डिस्कस किया करेंगे. और स्पेशल प्रोग्राम डॉक्टर तजमुल फाजली साहब के लिए हम शुरू कर रहे हैं कश्मीर क्राउन पर. बहुत बहुत शुक्रिया.
थैंक यू सो मच.